Welcome to all of you. I am Dr. Pam Cutler, President of the Montana Medical Association, and I am here along with my healthcare colleagues to present a clear and concise message to all Montanans. Thanks to everyone for joining us. It's quite a nice crowd. Our format for this event will be straightforward. First, we will hear from multiple individuals who represent a variety of frontline medical workers in Montana. We will then open up the floor for questions from the press. At that time, we ask that you use the raised hand function on your Zoom screen to signal that you have a question. Please know that we greatly value the work you do, and thank you for taking time to be with us today. So some of the organizations represented in this conference and by our speakers include Montana Professional Associations for nurses, hospitals, physicians' assistants, pharmacists, public health officers, and multiple Montana chapters of medical specialty organizations, including primary care, family medicine, pediatrics, OBGYN, internal medicine, emergency medicine, and infectious disease. The members of the many organizations we represent are overwhelmingly united in the message we want to share. Fighting disease is not a passing fad for us. It has always been our business, and we know what we are talking about. We must speak up right now because Montana is experiencing a rapidly increasing wave of COVID-19 cases.
Recording in progress.
Hospitalizations and deaths as well. It's rising much faster than we saw at this time a year ago in 2020. We want to avoid following the path of other regions in our country where these numbers have become so large and are putting untenable stress on their schools and healthcare systems. Our presentation will emphasize several points. First, we are united in urging Montanans to take action now to crush the climb in COVID-19 cases. Our message is based on researched facts and proven scientific data. We want to say to Montanans, make choices based on good medical facts, just like you would if you were confronting cancer or a heart attack. We want to say, now is the time to be vaccinated against COVID-19 before getting sick or before getting exposed. Currently, the vast majority of patients hospitalized with COVID are unvaccinated individuals. Our message is choose to protect yourself and your loved ones by getting a vaccine now. Also important, masking is a tried and true measure that protects the wearer and protects others too. It works. We currently recommend universal masking for grades K through 12. It worked for our schools last year, and it can keep our kids in school this year. Whenever there is a significant risk of disease transmission, we recommend masking for indoor activities. And as COVID cases are climbing, Montana hospital facilities are currently stressed, and we worry about them going beyond capacity. This would negatively impact all of the medical needs of the community, not just COVID needs. Please choose to protect yourself and your community before our healthcare system is overrun. We all believe in this message. We come from different backgrounds and persuasions, but we are united in asking Montanans to choose to once again do their part and come together. Thank you. At this time, I will turn the floor over to Dr. Greg Holtzman. Dr. Holtzman is boarded in family medicine, in preventive medicine, and public health. He has worked in these fields for over 20 years at both the state and the federal level. And as many know, he has been intimately involved in addressing the COVID pandemic in Montana from the very beginning. Dr. Holtzman.
Thank you. Thank you, Dr. Cutler, and I apologize. We are having some troubles with the mute system. Thanks, everyone. As a healthcare professional, we use guidelines from respected sources daily. You rely on your medical community in Montana to provide you with the best possible care. You come to us when you're sick. and you come to us for advice on how to stay healthy. We are here together telling you now that the very best thing you can do for your health is to take all the preventive measures you can to avoid the rising risk of COVID-19. Guidelines help us use the best possible care to treat specific cancers, how to best diagnose and manage one's blood pressure. We follow these guidelines from respected sources because we know they are developed by a multidisciplinary group of experts who review the research, look at the strengths of the data, and evaluate the risk benefit, and then set a clear recommendation for providers that will improve quality of care and will most often produce the best outcomes. In the midst of the spread of COVID-19, we are gathering new data constantly. Our health guidance has changed over time in response to the changing virus and new information. The guidance is clear. We need to use all the tried and true preventive measures that we have at our disposal right now. I'm a population-based physician. We often talk about the community being our patient. With COVID-19, we have excellent guidance to help us address the COVID-19 pandemic from places such as the Centers for Disease Control and Prevention, the American Academy of Pediatrics, the Infectious Disease Society of America, and I could go on and on. As a population-based physician, I'm very concerned that we are not seeing the success of controlling this pandemic because our patient, the community, is only being half treated to prevent the spread of this disease. Today, my colleagues will be going through some of the guidance for how we as Montanans can save lives, prevent suffering, and decrease the stress on our frontline healthcare workers. And let's not forget, keep our businesses open and our kids in schools. Let me now introduce Dr. Neil Hu, a board-certified infectious disease physician and epidemiology practicing at the Billings Clinic and a member of the Montana Infectious Disease Network. Thank you, Dr. Hu.
Thank you, Dr. Holtzman, for the introduction. So thank you for having the opportunity to speak to all of you. I would like to first start with just briefly go over the current COVID-19 statistics in the US as well as Montana. As of today, according to the Centers of Disease Control and Prevention, there are over 37 million cases and over 621,000 deaths due to COVID-19 since the pandemic has started. In Montana, DPHHS has reported over 121,000 cases and 1,752 deaths due to COVID-19. In the past 24 hours, 499 new cases of COVID-19 have been diagnosed. There are at least 200 active cases of or active hospitalizations for COVID-19. Despite a significant drop in the number of new cases of COVID-19 following the last surge, new cases continue to be diagnosed in Montana. In the past several weeks, the number of new cases of COVID-19 had been steadily increasing, as well as hospitalizations. Epidemiologically, essentially all of these cases of COVID-19 in the US and Montana are due to the Delta variant of SARS-CoV-2. I wanted to talk a little bit about this particular variant, as this variant is distinctly different from all the other variants we've encountered. Firstly, is that this variant those who are infected by this variant develop symptoms significantly shorter period of time than after infection when compared to other variants. Infected persons, those who are infected and present with symptoms, are found to shed more virus than those of other variants. Additionally, the virus have enhanced abilities to infect cells. Simply put, less viruses are needed to cause infections. Because of these last two characteristics, they allow this virus to spread more readily from person to person, to more person from one infected person who is compared to other variants. So for example, someone infected with the original strain can infect about 2.5 other individuals. Someone with the alpha variant can infect up to 4 to 5 other individuals, but someone with the Delta variant can infect at up to 5 to 8 or 9 persons. Now, our best defense against the spread of SARS-CoV-2 is vaccination and source control. And that source control specifically referring to the use of face masks. And I want to talk a little bit about both of these mitigation strategies. So regarding vaccinations, want to emphasize that the primary goals of COVID-19 vaccination is to reduce the risk of developing symptomatic COVID-19, as well as, and probably more importantly, is to reduce the risk of developing serious illness, hospitalization, and death due to COVID-19. The effectiveness of immunity from the currently available COVID-19s against the Delta variant is variant in those who are fully vaccinated. Now, there's been a lot of discussions about whether natural infection-derived immunity is better than vaccine-derived immunity. We have shown that those who are with previous infection may have some protection against reinfection, but they are more likely to get infected again when exposed to other variants as compared to those individuals who are vaccinated. And that's because the variants are slightly different. They're immunized to the previous variant, so they are somewhat more susceptible to the other variants. Whereas vaccination do have more broader coverage and seem to provide more protection against against many of the variants. Furthermore, a recent observational study published in the Morbidity and Mortality Weekly demonstrated that those with previous infection and are unvaccinated are found to have more than twice as likely to get infected again when compared to those who had previous infection and are fully vaccinated. So now, there have been a lot of reports about efficacy of vaccine, and I want to emphasize that no vaccine, including the COVID-19 vaccine, is 100% effective. The immunologic response to any vaccine, including this vaccine, is influenced by many factors such as age, chronic medical issues, and as well as impaired immune status. Thusly, breakthrough infections are expected, but they're fairly uncommon. Most breakthrough infections are mostly result in mild symptoms. Those who are vaccinated and experience, one added feature to vaccination is that those who are vaccinated and experience breakthrough infection, the duration at which the virus is shedding is much shorter than that compared to someone who's unvaccinated. And this is an important point I would like to make, because for those those who are vaccinated will be contagious for a very much shorter duration than those compared to those who are not vaccinated and develop infection due to the Delta variant. Another concept I would like to bring up is that as a transmission limiting strategy, it works best when the majority of the population is vaccinated. That is, the more the people in the community are vaccinated, the more protected that community becomes against COVID-19. Furthermore, the more vaccinated individual a population contains, the fewer the cases of breakthrough infections. And because of this, both the Infectious Diseases Association, a Society of America, and the Society of Healthcare Epidemiology America strongly recommend that all eligible individuals, especially health personnel, are vaccinated against COVID-19, unless there's an identified contraindications. Now, regarding masking, this is also another very hot topic. And I want to kind of bring up that masking is a very effective transmission limiting strategy. And multiple studies have shown that if properly and consistently used, it is very effective in limiting the spread of the virus. But like all other infection prevention strategies, it's not 100% perfect. But if it's used in conjunction with other transmission limiting measures such as vaccination, physical distancing, it further reduced the risk of the transmission of SARS-CoV-2. Because of the rapid rate at which COVID-19 was spreading in the US and the Delta variant being found to be much more transmittable than all previous strands, it was felt that the current proportion of vaccinated individuals in the US, including Montana, is insufficient to minimize SARS-CoV-2 transmission. It is because of this that the Centers of Disease Control and Prevention had updated their guidance to recommend masking of all individuals, regardless of their vaccination status, while in indoor public settings, in communities with substantial to high levels of SARS-CoV-2 transmission. And both the IDSA and SHE also endorse and consider the use of face masks by all individuals to be an integral part of any public health measures to reduce the transmissions of SARS-CoV-2. Two final points I would like to make is that these strategies are important not just to protect the individuals, which what many of us tend to, in the public tend to feel, but they're also are important because they protect those who cannot be vaccinated yet, and those who are also are extremely susceptible to severe illness due to COVID-19. But more importantly, the effectiveness of all these strategies mentioned is really dependent on the proportion of the population that employ them. Simply put, it will require the collective effort of the entire community to protect us from COVID-19 and to end the pandemic. Thank you.
Thank you, Dr. Koo. Much appreciate your comments. Next up is Dr. Michael Temporo. He is a board-certified family physician. He is speaking on behalf of the Montana Academy of Family Physicians and is current president of the Montana Academy of Family Physicians. Thank you, Dr. Temporo.
And thank you, Dr. Holtzman. You know, Montana family physicians support the science of getting vaccination as each person's situation allows. The current wave of the Delta variant has shown that people having the worst experience are those who have not been vaccinated. In fact, I just came back a week ago from a funeral for my own cousin in Missouri who was unvaccinated and died of complications of COVID. And unfortunately, many of you have probably had similar stories. As Dr. Koo has noted, the hospital data shows that those vaccinated have less severe symptoms, less duration of illness, and are less likely to be in the intensive care unit. We all take care of families, and getting vaccinated benefits not only the person who gets the shot, it also benefits those in their household, their local community, their loved ones, and can help people they don't even know. Vaccine has been available now in Montana for 8 months, and the benefits and their safety have clearly been demonstrated. While people can always find exceptions, vaccines save lives, and it's important to talk to your healthcare provider and get accurate information. And given that COVID illness impacts treatment of other chronic health problems, which we as physicians and you as patients manage every day, any attempts at risk reduction should be encouraged. Focusing on maintaining health and managing conditions is easier than having to deal with complicating factors, especially ones that can be helped by vaccination. So prevention and risk reduction is still possible. And we as family doctors ask you to help us take the best care of you. Thanks.
Thank you, Dr. Temporo. Next up is Megan Zawacki. She is a PA and a board-certified physician assistant representing the Montana Academy of Physician Assistants and the current president of the Montana Academy of Physician Assistants. Megan?
Hi, thank you. So we physician assistants of the state of Montana stand with our physician and nursing colleagues in getting our patients vaccinated and wearing masks. We understand the importance of this vaccine, the value of wearing masks to prevent the spread, and the repercussions when these recommendations aren't followed. As physician assistants, we have the privilege of caring for all patients, pediatrics to geriatrics, in any and every healthcare setting in Montana. We've seen the impact of COVID on our patients, our colleagues, our healthcare facilities, and our communities. I myself have been pulled from my normally scheduled clinic where I see my patients and have been sent to urgent care to help see patients that are suspected of having COVID, as well as covering impromptu clinics and swing beds. A swing bed that was developed to care for elderly patients that had been discharged from the hospital but had no nursing home availability due to the pandemic. An Army-style unit set up for the homeless patients in Billings, where the patients had COVID, but nowhere else to go. So we remember the helplessness of last spring, when a novel virus was wreaking havoc on our country and our state. We saw the distress in our patients and our coworkers alike, and all we could do was wear masks. And we hoped and we waited. Since then, we've found that schools can stay open and our kids can stay safe if we wear masks and if we're careful. Then we received a miraculous vaccine, and we've been able to vaccinate a portion of our most vulnerable population. We encourage vaccines for everyone who can get them, and we support masks in school, where our youngest members of society have no vaccine option. So we want to keep everybody safe, especially Montana's most valuable resource, our children.
Thank you. Thank you, Megan Zawacki. Next up is Dr. Lauren Wilson. She is a board-certified pediatrician and the current vice president of the Montana chapter of the American Academy of Pediatrics. She is speaking on behalf of the Montana chapter of the American Academy of Pediatrics. Dr. Wilson?
Hi, everyone. Thank you for coming. The Montana chapter of the American Academy of Pediatrics is an organization of 146 Montana pediatricians, and we're speaking to you on behalf of Montana kids. Kids under age 12 are not yet eligible for the vaccine and are at risk from the Delta variant of the SARS-CoV-2 virus, which is 2 to 3 times more transmissible than what we were dealing with at this time last year. Without the ability to be protected by a vaccine, kids are being infected by the Delta variant in great numbers, and some are getting seriously ill or having long-term symptoms. To give you a sense of that, this week, the US had the highest number of children hospitalized for COVID at any point during the last 18 months of this pandemic. Kids have already sacrificed so much during the pandemic. Many have struggled with remote school, and not everyone has had access to internet or technology. School is not only important for education, it's important for social and emotional health. Part of a child's normal development involves interacting with peers in person. So the best thing we can do for our kids is to keep school in session and to do our best to make it safe for children to attend. Luckily, we have lots of data from last year that schools that put in place layers of protection saw very little spread of COVID within school walls. This means using multiple protective strategies like everyone wearing masks, reporting symptoms and staying home when sick, distancing, improving ventilation, and getting adults vaccinated. We also are seeing now before our eyes that schools in the Southeast that are not doing those things are quarantining hundreds and having to shift to remote learning. Many schools have closed due to spread and lack of staff as a result. Mississippi today is reporting 20,000 children quarantined and over 4,000 with COVID. Masks are effective in reducing spread, and they're much more effective at doing that when they're worn by everyone. We should also be aware that in every Montana community, there are kids with disabilities, kids with chronic illness, kids with obesity, kids with immunodeficiencies, who are especially at risk from this virus, and they deserve a safe school environment too. They can't safely return to school without measures in place, but they deserve to benefit from in-person learning. We're speaking up today to urge school boards to maintain layered protections in the face of rising COVID transmission. We can keep children in school safely with the tried and true methods we used last year, which include universal masking. In our communities, we urge everyone, adults and kids, to get vaccinated. And in most Montana counties where there's substantial COVID transmission, to wear a mask indoors. That's all we're asking, and we're asking it on behalf of our kids. Our kids shouldn't bear the burden of our failure to act decisively. Thank you.
Thank you, Dr. Wilson. Next up is Dr. Heather Zielinski. Sorry, Heather. She is a board-certified child psychiatrist and chief medical officer of psychiatry at the Shodare Children's Hospital. She is speaking on behalf of Shodare Children's Hospital and the Montana Association of Pediatric Psychiatrists. Dr. Zielinski, sorry.
Good afternoon, everybody. This is Heather Zalewski, and I am, as Dr. Holzman mentioned, medical director here at Shodair Children's Hospital, and I am also part of the Montana Association of Pediatric Psychiatrists. And I'm here today to talk about the impact that the COVID-19 pandemic has had on children's mental health. Simply put, the COVID-19 pandemic has had devastating effects on children's mental health. This is supported by both state and national data. Nationally, emergency department visits for mental health crises went up during the pandemic by 31% in teens and 24% in children. In Montana, where we have had a suicide epidemic for long before we had a COVID-19 pandemic, the 2020 teen suicide rate was roughly 12% higher in 2020 than it was in 2019. However, I imagine that you don't need me to cite statistics to know that children's mental health has suffered during the pandemic. If you are a parent, a grandparent, aunt, uncle, if you have any children in your life in any capacity, you likely have seen this for yourself. On a personal note, I can tell you that my two youngest children were both freshmen in 2020. One was in high school, one was in college. My daughter, the high school freshman, went from a straight A student to barely passing. And my son, the college freshman, went to school with a pre-med major, hoping to be a physician someday. However, his grades his freshman year suffered due to the hybrid model that MSU was employing, and now he may need to give up that dream. We know what promotes healthy emotional development, and conversely, what is detrimental to children's psychological well-being. Learning and growing academically, spending time with peers, having routine and structure, and feeling safe in the world all promote healthy child development. Conversely, being isolated from peers, worrying about the state of the world, losing loved ones, and failing academically are all detrimental to children's mental health. For these reasons, it is of utmost importance that we do everything we can to prevent a worsening of the COVID surge that we are currently seeing in Montana. We need to follow the science and take steps to protect our most vulnerable citizens, the children of Montana, from another year of distance learning and social isolation. Their lives are at stake. Thank you.
Thank you, Dr. Zalewski. Next up speaking is Dr. Drew Mullaney. He is a board certified obstetrician and gynecologist. He is speaking on behalf of the Montana chapter of the American College of Obstetrics and Gynecologists. Dr. Mullaney.
All right. Thanks, Dr. Holtzman, and welcome everybody. So I'm going to be talking about a press release that was recently put out by ACOG, which is American College of OB/GYN. It was put out along with that organization plus 20 other organizations. And they stated that as the leading organizations representing experts in maternal care and public health professionals that advocate and educate about vaccination, we strongly urge all pregnant individuals, along with recently pregnant, planning to become pregnant, lactating, or other eligible individuals to be vaccinated against COVID-19. So there's been enough information that they've been able to gather that they feel that the vaccination against COVID during pregnancy is an okay thing to do. Pregnant individuals are at increased risk for severe COVID-19 infection, including death. With cases rising as a result of the Delta variant, the best way for pregnant individuals to protect themselves against the potential harm from COVID-19 infection is to be vaccinated. Maternal care experts want the best outcome for their patients, and that means both a healthy parent and a healthy baby. Data from tens of thousands of reporting individuals have shown that COVID-19 vaccine is safe when administered during pregnancy. The same data has been equally reassuring when it comes to infants born to vaccinated individuals. Moreover, COVID-19 vaccines have no impact on fertility. So pregnant individuals and those planning to become pregnant should feel confident in choosing vaccination to protect themselves, their infants, their families, and their communities. Recently, I saw a patient yesterday who is pregnant, third trimester, and is a teacher, and she was super stressed out about going back to school. Wasn't sure how this was going to work. And so she did get the vaccine. And when I talked to her yesterday, she's about 2 weeks out from her second shot. And she was feeling much, much better, that, it's made a big impact on her life, and feels as if she's done everything that she can to protect herself against this infection. So main points for today: make sure people that can get vaccinated do, and wearing masks when needed. Thank you.
Thank you, Dr. Mullaney. Next up is Vicky Bird. She is a 32-year Montana registered nurse and the Chief Executive Officer of the Montana Nurses Association, which represents and advocates for registered nurse and advanced practitioner practice registered nurse. She is speaking on behalf of the Montana Nurses Association. Vicky Bird.
Thank you. Thanks, Dr. Holzman, and thanks everyone for attending. The Montana Nurses Association recognizes that this will take all of us working together to control the spread of this COVID virus. Nurse staffing shortages existed prior to this pandemic, but have currently been made worse due to the COVID virus. RN vacancy rates are increasing and travel nurse usage is increasing. That's even if the employers can secure them. Montana hospitals and long-term care facilities, public and private, critical access and large facilities are utilizing our state's Montana Health Mutual Aid System for disaster relief, calling for nurses to deploy across our state to staff their facilities. Community Medical Center in Missoula and Mountain View Care Center in Ronan are two recent examples. Montana nurses are exhausted, but we're very resilient. They experienced the COVID wave last year and responded by working overtime, compromising their family time, and by working understaffed, vacations and time off canceled to care for you, and they are responding again. However, we need our Montana citizens to respond now to help tackle this public health threat together. Choose to act now. Now is the time to get vaccinated and/or simply wear a mask. Bringing masks back for vaccinated people, especially while indoors, reduces the risk of that person with a breakthrough infection infecting an unvaccinated person who remains at a much higher risk of serious illness or death. While it's impossible to know who is vaccinated and who is not, let's just take care of each other and our entire state by wearing a mask. Masks, hand washing, social distancing remain our easiest, most non-invasive method to help stop the spread of COVID. Let's keep our state open by simply asking those who are not vaccinated to wear a mask. For those that are vaccinated, kindly wear a mask while you're indoors in the public. The COVID vaccine continues to be remarkably effective in reducing risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. MNA, Montana nurses, and our medical and healthcare community is simply asking everyone, get vaccinated for those who can. Please wear a mask, especially if you're unvaccinated. And kindly wear a mask, vaccinated or not, in public areas. Let's keep Montana, your Montana healthcare workers, and fellow Montanans safe. MNA kindly asks, please get vaccinated and wear a mask. Thank you.
Thank you, Vicky. Next up is Dr. Greg Hansen. He is a board-certified family physician, a CEO of a Montana Critical Access Hospital, and chairman of the board of the Montana Hospital Association. He is speaking on behalf of the Montana Hospital Association. Dr. Hansen?
Thank you, Dr. Holtzman. A number of Montana hospitals are currently at historically high census levels. I was on a call yesterday with a number of our larger hospital chief medical officers. Many are at or above normal bed capacity, and a number are holding patients in emergency rooms until beds open up to be able to move patients to. I've spoken with both clinical and administrative colleagues at a number of critical access hospitals and have found stories where they are having to call and transfer patients as far as Utah in order to find open beds. Montana was largely spared from this sort of problem during previous national surges. We may not be so fortunate this time unless we Montanans make a significant intervention as we did before. We've seen a 6-fold increase in average daily COVID cases since July 1st, and the current trend will lead to a doubling in 2 weeks. We need to maintain space to care for all patients, those with COVID and non-COVID medical problems. Arresting the spread of COVID and limiting its impact on individuals will have a dramatic positive effect on our hospital's abilities to do so. In addition to the problems that can arise related to bed capacity, the pandemic has taken a toll on healthcare workers, making every part of their job and life more stressful and difficult. We need to limit that stress so our caregivers can remain healthy, both physically and emotionally, if we want them to be able to give needed care. The overwhelming majority of hospitalized COVID patients are unvaccinated. That piece of information itself argues that vaccinations are a useful and effective tool to combat the development of severe COVID-19 disease. MHA, the Montana Hospital Association, and its member organizations ask that you would please help us maintain the ability to care for all Montanans' healthcare needs by doing your part. Get vaccinated and wear a mask. Thank you.
Thank you, Dr. Hansen. Lastly, I'd like to bring up Dr. Nathan Allen, who is a board-certified emergency medicine physician and a healthcare ethics consultant. He is speaking on behalf of the Montana chapter of the American College of Emergency Physicians. Dr. Allen?
Thank you very much, Dr. Holzman. In emergency medicine, we pride ourselves on being prepared for anything. We're there 24/7, 365 to provide care for people when they're sick or injured. With the help of the community, we've successfully managed a COVID-19 surge in Montana before. Right now, hospitals' emergency rooms around the country are filling beyond their capacity due to the surge of COVID-19 infections. The entire healthcare system in some states are reaching their capacity. At our hospital, we've been getting calls from as far away as the Gulf Coast of the United States looking for open beds to transfer patients to. This means that these places, it's not just patients with COVID, but patients with heart attacks, strokes, and car accidents who are having trouble getting the care they need. In addition, we're seeing rapidly rising rates of PTSD and other stress-related illnesses in the healthcare workers who've been caring for COVID patients throughout the pandemic. The ongoing tragedy of preventable deaths, increasingly among younger patients, is leading to career nurses and physicians leaving the practice of medicine entirely. We don't want this to happen in Montana. We want all Montanans to know that we are there for you, we will be there for you, and we need your help. By working together in partnership and choosing to follow the health advice that we're sharing today, we can keep our communities safe and healthy. Now is the time to get vaccinated and protect yourself and your loved ones. Now is a time when choosing to wear a mask helps most to prevent further surge of COVID-19 and protects and preserves the capacity of our hospitals and our emergency departments to care for you and your loved ones when you're sick or injured. Thank you.
Thank you, Dr. Allen. And thanks to all our speakers today and all the healthcare organizations and healthcare and public health providers who are represented here today, those who spoke and even those who did not speak. Prevention in healthcare is always challenging. You do not know whose life you saved or whose suffering you prevented. All we know is there are more children being raised by their parents, more grandparents part of their grandchildren's lives, and many healthy individuals who can enjoy their lives without physical or mental anguish. I would now like to hand the microphone back over to the president of the Montana Medical Association, Dr. Pam Cutler. Dr. Cutler?
Thank you, Greg. So I just want to say that our message comes from having studied the situation, and it's based on research facts, scientific truth. This has always been our work, and our words can be trusted. Vaccinations are our best weapon. Please get vaccinated if you can. Indoor masking is key for decreasing spread, and children particularly need to protect each other in schools and wear masks. We know this virus is changing all the time, and we do not know all the long-term impacts of the current disease or of any new variants that might develop. Prevention is the best course. And the stress on the Montana healthcare system is real and it's increasing. We need to protect it and turn the climb of this virus around. You know, we are the people collectively that Montanans trust with their health every day. What we are asking is not complex or high tech. These are simple yet important choices for individuals, families, small towns, and communities across our state. Thank you for listening. I will now open up the floor for questions. And again, we ask you to please use the raised hand function on the Zoom screen to signify that you have a question, and Lauren will unmute you. Dr. Holtzman, I think, is going to moderate this.
Yes, thank you.
So Lauren, we'll let you drive the unmuting.
Yep, John Riley with MTN News has a question.
Hi, thank you so much for hosting this press event today. My question is, the Biden administration has recently indicated that they will be withholding federal funds for organizations like nursing homes, which we have healthcare professionals in working if they don't get vaccinated. Is there any concern that for those healthcare professionals that are choosing not to get vaccinated, that might drive them away from organizations like those nursing homes or hospitals if there becomes a mandate internally?
Thank you for that question. Dr. Hansen, would you like to first take a shot at that? And Rich from the Montana Hospital Association, if you'd like to comment, please do.
Yes, certainly that information came out yesterday, and so we've been putting a consideration to that. There's no doubt that there are individuals on a spectrum in terms of resistance to obtaining vaccinations, and that does include some healthcare workers. I think that it's going to be difficult to answer the impact that's going to have until we see some of the specifics in terms of what the regulations that come out are. There are those who will insist upon some sort of a variance from that, as there are for many vaccines now, and the impact that could have on some healthcare workers' decisions, I think, is going to be very relevant.
And just to piggyback on what Dr. Hansen mentioned, I think that this is the very issue that we mentioned during the legislature, when you would have federal policy contravene state policy, and that's where we are today. So with the federal government now requiring nursing homes to require vaccinations of their employees, it does put nursing homes in a difficult position of following federal law now and having it conflict with state law. And so each organization is going to have to measure how they're going to comply with this. The difficulty here is that if a nursing home refuses to do that, or they can't comply 100%, they have the potential of losing their Medicare and Medicaid funding. And so this is where we're starting with nursing homes. Everyone is waiting to see whether or not this will be extended to hospitals. And again, this would be 100% avoidable had the legislature not chosen to put nursing homes in this very difficult position.
Thank you. And I believe Dr. Allen would like to add a few more comments on that.
Yeah, thank you, Dr. Holzman. I just wanted to comment at a personal level. I've been in healthcare for a little over 20 years now. Every volunteer position, training program, organization that I've worked for and job that I've held has required me to have multiple vaccines to keep both myself, my coworkers, and my patients healthy. It's something that I do with pride to keep my community safe, my coworkers safe, and myself safe. What I would like to see all Montanans do is make that personal and voluntary choice to help protect themselves and protect their community, so that we can get all of those benefits of working together and we don't even need to talk about or worry about penalties.
Thank you, Dr. Allen. Lauren?
Next up is Emma Wolfhorst.
Hi, everyone. Thank you so much. My name is Emma. I'm a reporter with NBC Montana, and I'm based in Bozeman. So I kind of had two questions going off of the first question from NTN about the vaccination requirements. With hospitals, obviously, we're having some national disagreement with federal laws and state laws when it comes to long-term care facilities and nursing homes. When it comes to hospitals, you guys talked about staffing shortages. Is there any issue at all with not being able to require or mandate vaccinations for employees that are leading to potentially more staffing shortages as people are potentially contracting or needing to be on quarantine?
Thank you for that question. I will go back to Dr. Hansen, and again, Rich, if you'd like to also jump in, please do.
Greg, I'm happy to respond.
Go ahead.
Yeah, I'm trying to get there.
My mute kept popping me back on mute again.
It wouldn't unmute. I have not heard of significant problems arising in our state related to that at this point, but I will share with you that, and this piggybacks onto the workforce issue, as we have reached out wider and wider in terms of hiring people, there are folks that are now moving, particularly to Western Montana from Washington State, since their implementation of the mandatory vaccination that's been put out. So clearly there are people out there who feel very strongly about this, and we'll just have to see how large of an impact that will be in the long term.
And again, to echo those comments, not knowing what the federal government may do in terms of their policy relating to hospital vaccinations, if this is mandated nationwide, then I think it solves the concern that hospitals have long had, is that they wanted to be able to preserve their right to be able to require a vaccine if they felt that was most appropriate in their setting and in their community. If it is applied nationally, then certainly the exodus that you might see from Washington to Montana, that could be very different, as every essential organization, being hospitals and nursing homes, would have a requirement placed upon them. So we'll have to wait and see what the next step is in terms of how the federal government approaches this. Some states, some governors have gone forward on this, not a large sum yet, but if the federal government could change this curve very quickly.
Thank you.
Oh, sorry, I just had one other question.
Sure.
Thank you. You guys kind of touched on it a little bit, but obviously staffing shortages and trying to get enough people into the workforce to help right now. I got a tip from someone that Montana's having a hard time bringing in traveling nurses and traveling healthcare professionals due to our housing crisis and the fact that there isn't really any availability of short-term housing, especially in areas like Bozeman and Missoula. So is that a factor at all? Are you seeing that as a challenge with trying to get more staff in right now during this time?
Vicky Bird, would you be interested in answering that along with Rich? And anybody else who is interested, please raise their hands.
Sure. Thanks, Emma, for the question. I can just share some feedback that we're hearing from nurses on the ground, and many of them are coming to Missoula or Bozeman to work, but they can't afford housing. They can't secure housing. They're sleeping on their friend's couch. Some of them are sleeping in their car, and that's just very real. So we have to look at, the economy in Bozeman is so high to live there compared to maybe Helena or even Kalispell. So it's significant. And I think it's something that needs to be addressed and be considered as we look at how we bring not just travelers, but how do we bring nurses to come in here and live and raise their family and be able to work in our areas to take care of our patients.
I think there's a couple of things, Emma. Certainly housing is a challenge. It is. We surveyed our members and tried to identify what were the largest impediments to recruiting, securing, retaining, and rewarding our nurses. And it was housing, childcare, and finding a position for a spouse. I mean, those are the items that came out of our survey. Now, where we are today, the challenge is that all 50 states are looking for staffing. And so we're competing with everybody on this. And because we no longer have a public health emergency, we do not have the expedited licensure process that we had prior to July 1st. And so it takes a longer time now to process the licenses, not just for nurses, but any other licensee. So one of the things that we've done is we've asked the governor's office to consider creating or establishing a workforce state of emergency in our state, to give them some additional powers that can allow us to go back and utilize the streamlined licensing process that we had prior to July 1st. And by doing that, it can allow us to, again, accelerate that and make it quicker for us to bring folks into our state. And we've also talked too about looking at the state exercising a master contract like we did last fall, which would allow the state to immediately access additional outside contracted healthcare workers to help us in our communities where we have significant surge going on right now. Those two tools were very effective up until most recently. And so we hope that they will consider exercising on those two issues.
Thank you, Rich Rasmussen. Is there the next question?
It looked like Dr. Hansen was trying to chime in there.
Sorry, Dr. Hansen, please.
I just wanted to make it clear that it is not just related to hiring of nurses, nor is it related to our larger communities or Bozeman or Helena in particular. Plains has a population of 1,300. I've hired a physician who is having a difficult time finding a place to live. We lost a physical therapy hire because they could not find a place to live. And it's impacting not only our professionals, but our non-professional staff having places to live and being able to work in our communities.
Thank you.
Next up, we have Matt Bowles.
Hi, thanks for the opportunity. I'm Matt Bowles from Kaiser Health News. Is anybody from the DPHHS or the governor's office on this call who supports or can otherwise respond to your message encouraging vaccinations and masking? And if not, were they invited and declined to participate?
The governor's office was notified of this and informed, and there are some folks from DPHHS on the call. I don't know if they feel comfortable speaking at this time, and I would probably recommend the best thing for you to do is call them after the press conference to specifically talk to them. But they are invited and are listening in, and we could appreciate to continue to work with all the incredible individuals that are over there.
Thank you. But just to clarify, were they invited to participate in this press conference and decline? I mean, to speak?
No, they were not. We did not specifically invite them to speak. We did not. It was an oversight if we did, and I apologize. But no, they did not decline, and we did not ask them if they would like to speak.
Okay, thank you.
Next up, we have Iris Samuels.
Thank you. This is Iris. I'm with the Associated Press, and I was hoping some of you can elaborate more on how the new law prohibiting vaccine requirements has impacted your ability to care for patients, both with COVID and others so far.
Yeah, thank you for that question. Dr. Wilson, would you be willing to start off on those comments? And then Dr. Cutler and any of the other providers, Dr. Allen, if you'd like to speak, please let me know.
Sure. So I believe you're referring to HB 702, which was the law making vaccination status a protected class. So that law applies differently to healthcare in different settings, which is problematic for us. Some of the healthcare facilities have exemptions that allow them to make some reasonable accommodations, but we're not really clear on where the line is and what we're allowed to do under that law. It's a little bit difficult for us right now. There are some settings like private offices and federally qualified health centers that don't have an exemption under that law and are not allowed to make reasonable accommodations. And so we do worry about the implications for patient safety as a result. We also worry about some staffing issues that can arise when CDC guidance says that, for example, someone who's vaccinated and exposed could continue to work masked, but we're unable to do that because we're unable to treat them differently. So that can exacerbate current staffing issues. And anyone else who has anything to say can chime in as well.
Yeah, this is Dr. Pam Cutler. I was recently the president of a multi-specialty group at Missoula, the Western Montana Clinic, and we have no exceptions for this House Bill 702. And what was so difficult for us is that this House Bill 702 applies to all vaccines. We cannot require our staff to get any vaccine. And this is against everything we've ever known or believed about public health and about the value of vaccination programs. I mean, just like Dr. Allen mentioned earlier, it has always been the standard across our country that you have to get certain vaccines, and it makes the environment safe for your coworkers, for your patients, because doctors' offices are where sick people go. And that's where you want people to be protected against various of illnesses that we have the capacity of modern medicine to be able to do. And I read a comment this morning by the CEO of the of Benefis Hospital in Great Falls, where he said, thank goodness this law wasn't in place when polio and smallpox, those other diseases, measles, chickenpox, which killed children in large numbers back in the day. Thank goodness that law wasn't in place then, because it would have been a travesty. And I believe it's a travesty now, and it needs to be fixed so that we can make our offices safe for patients and for our coworkers.
Thank you, Dr. Cutler. Dr. Allen? Looks like you're on mute.
There we go. Yeah, I would just add to that I think the impacts here are largely unknown. This is still a really new law. There's not all of the precedent established yet for it here. I have enormous concerns for the health and safety of people in our state, that you can no longer be confident, if you're a pregnant woman going to see your doctor, that all of the people who might be involved in your care are immune to a disease like rubella, which could have devastating effects if you were to acquire it while pregnant. And I would strongly encourage, our legislature to rethink this legislation, as vaccination has been a part of work in the healthcare field for decades and has been able to be done in a manner that preserves the liberty of people working in healthcare, but protects the health and safety of our patients and ourselves.
Thank you, Dr. Allen. Dr. Hansen, did you want to say something? I noticed you were on. Okay, I'll assume. No.
I just got unmuted. I don't think I have anything to add. Those were all very good comments, and the major points of the concerns we have with House Bill 702 and the difficulty in implementing.
Thank you. And Dr. Koo, did you want to say something?
Sorry, some trouble with unmuting. Just to kind of echo with what everyone else and what Dr. Allen has said. I work intimately with our, not just with our system of Billings Clinic, but also I sit on a national board with the Society of Healthcare Epidemiology of America, where we kind of exchange ideas about what we can do to make healthcare settings very safe. And it is very, very difficult for me to participate in that conversation when everywhere in the country can talk about vaccinating their employees, but I can't. I think that, I agree that we don't know the full impact of this bill, but certainly I would say I have spent a significant amount of time having to rewrite many of our healthcare and infection control policy because of this. And yes, this does exacerbate some of the staffing issues, because if a nurse who is, let's say, applies for a specific position, such as being a dialysis nurse where hepatitis B vaccination is required, and we hire them, but then refuses to get vaccinated, then it's really difficult to kind of reassign someone, because that person was really hired for a very specific role. And then we're forced to having to find someone else, which is really challenging, especially now in this day and time. So I think that, although we don't know the full impact, there is a lot of implication, and it makes certainly me as a healthcare epidemiologist, very challenging to try to help offer public health recommendations to mitigate a lot of the issues that we're encountering as a result of the pandemic.
Thank you. And I think it's real important to highlight our main point of today's conference is the unified message that we are all bringing forward, that it is important that if you can get vaccinated, healthcare worker or not, to get vaccinated and to mask up in the situations that have been recommended to, such as in indoor places and in schools, and in school locations, among others. Thank you. Is there further questions?
Hearing none, I think it might be time to close, but before we do, I just would like to say one thing about, I think it was Matt's question about inviting DPHHS to this. We really saw this press conference as an opportunity to hear from the people who deliver healthcare. It was not like we were excluding the government, but we wanted this to be about those of us who are your healthcare providers in this community. And the governor has said, talk to your doctors when you're making these decisions. That's us. Talk to your providers, talk to the nurses, that's us. And that's what we're here to give that message for. And that said, great conversation, great comments. I so appreciate all of you, my colleagues who've been here, and we appreciate you and the press who've taken your time to get our message out, because we think it's very important. Should you have further questions, there are several members of the Montana Medical Association, others who'd be willing to talk to the press. Please contact Lauren Lewis at the MMA for these contacts if you need them.
It does look like John Riley does have a follow-up question. Do we have time for him to give us one more?
Sure.
Thank you. Just because I'd be remiss not to ask it, because it seems to be the #1 Facebook comment and message that we consistently get about the safety of the vaccines. How many serious reactions to the vaccine are you guys aware of in the state of Montana?
Dr. Koo, would you be able to speak on that more broadly? I don't think that we will be able to speak specifically in the state of Montana because we don't have that data right in front of us. And I would recommend talking to the Department of Public Health and Human Services. But I think in general, we can address that issue.
Yes. So, I can more kind of relate to my experience here at Billings Clinic and some of the reports I'm hearing from nearby St. Vincent's. Reactions do happen, but I think that severe reaction as a result of vaccine is still very uncommon. I would say that it's very relative to the number of vaccines given, that the percentage of severe reactions as a result of vaccination is much less than 1% of the vaccine doses given. Certainly, there are probably the most frequent are the what they call grade 1 and grade 2, where there's like, the soreness of the arm, some redness, swelling surrounding the injection site, as well as fever. And those are the vast majority of the reactions that we do here. And that's also reflects that's been reported on the VSafe as well as VAERS. As for the exact number, I don't have that, at least not for Montana.
Thank you so
Dr.
much.
Koo.
I will just say I worked at a significant number of vaccine clinics in Missoula for the Western Montana Clinic and St. Patrick's Hospital. And we had a handful of people with allergic reactions when they received the vaccine. And they were, the way we gave the vaccines out were set up in a way that kept them safe. And we were able to monitor them and see if they needed any further treatment or if they needed referral to an allergist, which was done. And it was less than 0.1%. It was a very small number. Yeah.
And I would also add, vaccines are highly researched and monitored. We are very, very cautious with vaccines because we know we're giving it to a healthy individual. And thus, they are monitored very closely. In the United States, there's been over 357 million vaccines already given. In Montana, we are very close to 1 million if we're not there yet. The risk-benefit ratio is not even close. Pam, I think if you want to end it up.
Yeah, I think that means it's time to end it up for real this time. John, appreciate you sticking in there and getting that question. I hadn't noticed your hand raised. So again, thanks to everyone. We're here if you have questions, contact the MMA. We'll be happy to address further issues that might come up. Thanks for all the participants. Go out there and be safe. Wear your mask, get vaccinated. Thank you.